What if the dental procedure that's supposed to save your tooth could actually be making you sick? Root canals are one of the most common treatments in dentistry, but what if I told you that they could be silently fueling your chronic illness, your autoimmune disease, even cancer? The scary part, you guys, is you'd never even know it's happening because they're hidden. You can't feel it. Most bad root canals don't actually hurt. They sit there hidden, leaking toxins into your body for years. You guys, in today's episode, I am joined by Dr. Leonard Fazio, who has been my dentist for almost 2 decades here and a pioneer in holistic dentistry. And we are going to expose the dark side of root canals, the illnesses that they've been linked to, and more importantly, the alternatives you need to know to protect your health. This conversation could change the way you think about dentistry forever. Welcome to True Wellness with Dr. D, the podcast where we explore what it takes to live with vitality, balance, and purpose. I am Dr. D, and each week I'll bring you powerful tools, inspiring stories, and expert insights to help you thrive in every area of your life. From health and wellness to mindset and navigating life's challenges, this podcast is your guide to creating a life of true well-being. Be sure to check the show notes and grab your free copy of the True Wellness Checklist so you can get started on your journey to true wellness right away. Now, let's get started. Okay, what if the procedure that's supposed to save your tooth could actually be silently sabotaging your health? Root canals are one of the most common dental procedures in the world. But beneath the surface, no pun intended, there's a story that few people are being told. And today we're actually going to pull back the curtain on certain dangers of root canals and how they might be impacting your whole body health in ways that you may never have imagined. So I am excited to be joined here by Dr. Leonard Fazio, who is a pioneer in biological and holistic dentistry. And of course, he was my dentist for nearly 2 decades as I lived on Long Island. And he is Long Island's top holistic and biological dentist for all you Long Island New Yorkers. You definitely want to go check him out. But Dr. Fazio, I mean, he's known for challenging the conventional wisdom, not just in dentistry, but also when it comes to root canals. So he's got decades. I mean, you've been working with me for at least
a long time.
Decades of experience and knowledge where he's actually seen firsthand how dental procedures can either support or undermine our overall wellness. So, Dr. Fazio, I am so excited to have you here today because we've got a lot to talk about.
Yes, we do.
You know, people, we talked last time on our last episode of the podcast, which you guys will have it in the show notes. So if you want to go back and hear that episode as well, just go ahead, find it in the show notes and click and listen. But we talked about things like cavities and dental materials for fillings and that kind of stuff. But we barely scratched the surface on root canals, which needs its own topic of conversation because it goes that deep. So I want to dive in because I'll tell you, as a holistic, as a natural health functional medicine practitioner, we know that dental infections are a really big deal. Yeah. And I've seen so many people come in with autoimmune disease and such where they're like, I don't know what's going on. And then we discover that there is a root canal that's gone bad. And most of the time they don't even know that it's gone bad.
Right.
So let's dive in. So first of all, I guess we should kind of clarify for people, like, what the heck is a root canal?
Well, okay. So a root canal procedure or root canal therapy is the process by which the dead or dying nerve tissue and blood supply that are typically located within the tooth, within the root system, is intentionally removed and remaining tooth structure attempted to be sterilized in order to alleviate the pain, the swelling, infection, whatever, and allow then the symptoms to abate to the point where the patient can have the lack of pain and be able to salvage or keep the tooth. So typically when someone's having a significant problem with the tooth, the first option they'll be offered would be to save the tooth by using or performing root canal therapy. Now, typically, most people are going to agree that they would prefer to save their tooth, and the dentist wants to save their tooth, which makes sense, as opposed to losing it. And so most persons will consent to having root canal therapy done in order to save the tooth. The problem lies in that most persons are not fully informed as to the risks or downside to the procedure, life expectancy of the tooth, and so forth. Most persons, including the dentist, will be focused on the problem at hand, which is usually the pain and or swelling that presents, and usually the patient's making that decision right in the chair, whether to have the root canal therapy and keep the tooth or to extract it. Because typically at that point, it's one or the other. And again, most sane people, most logical people would think, yeah, save my tooth, and do. But as you alluded to in the intro, most people are not bargaining for what may come after. So after initially eliminating the nerve pain and or swelling with the procedure, those teeth, as you alluded to, could become slowly infected again with zero symptoms. And so most persons might not know that there is a problem that may occur later on. Now, Danielle, I want to add that the reason for all this is that it's not necessarily the fault of the dentist who's prescribing it or doing it, but really the problem lies in the procedure itself. The inability to completely sterilize the inside of a tooth, which if anyone looked at under a very powerful microscope like an electron microscope, one would notice that the inside shape and morphology of the root is very complicated, extremely complicated on a microscopic level, and therefore to expect that an infected tooth or a situation where the inside of the roots of that tooth had been affected, in which the nerve died off, that area cannot be fully physically cleaned out, and therefore attempts at complete sterilization or sanitization usually fall short. Depending on the amount of effort the operator puts in, the dentist puts in there, someone's taking his or her time to really clean out those areas and basically hollow out the tooth and remove the debris that's in there and attempt to sterilize it. Again, a success will be achieved by virtue of the swelling going down, and maybe even see some improvement on the x-rays following the procedure, and the patient's happy because their pain is gone and their tooth is still there. But as I alluded to, the real challenge is in the conventional means of sterilizing the inside of the tooth. Typically, during the time that the nerve and blood supply are physically being removed with these microscopic files or small files that are designed to grab the material out and reshape the inside of the tooth roots, that the sterilizing procedure is nothing more than using sodium hypochlorite, which most people would know would call or refer to as Clorox bleach, or any kind of household bleach. Most people are surprised to hear that, but yet we know that bleach will sterilize most anything it comes in contact with. But the problem lies in the roots again, okay? The internal morphology or structure of the tooth, which does not lend itself well to irrigation of liquids of any kind. If anybody knows anything about science, we know that there is a property of liquids we call surface tension, which does not allow liquids to disperse so readily, especially in tight spaces.
Right.
Whereas something like a gas readily wants to disperse, and therefore, when using a bleach or sodium EDTA or some other concoction to rinse out the debris that is created during root canal therapy, invariably some debris is left behind. And invariably, there are areas of the root that cannot physically be cleaned out, and therefore organic material, which is rotting out, will be left behind inside the tooth. Now, again, enough sterilization or sanitization of the tooth will alleviate and reduce symptomology to the point where everyone thinks it's a success. And if the procedure is completed, the patient's feeling happier, and it looks good on an x-ray, most people consider that the end of the story. Unfortunately, that may be just the beginning.
Okay, so what I hear you saying is the problem is we think we're cleaning something out, but essentially we're doing maybe a little bit of a cleaning job, but then there's stuff that's left in there. We're then sealing it up and it's left to basically rot?
Correct. So again, we're getting enough sterilization of the root to alleviate the symptoms, but yet no one, and I mean nobody, could ever promise that any endodontist or conventional dentist is able to sterilize the tooth 100%, and or to allow that tooth to remain sterile for eternity. The reality is that we're reducing the amount of infection inside the tooth with good dental treatment, and again, reducing the overall toxicity in that initial period to the point where the symptoms will dissipate or disappear. But invariably, the tooth becomes reinfected inside, and any organism that can survive and reproduce inside of a non-oxygen environment like the inside of a sealed up root canal tooth is pretty bad bugs. And it's the byproducts of those organisms that can leach out of the roots, again, due to the design of roots and how the dentin tubules radiate out from the root canal to the surrounding periodontal ligament space, which is the microscopic space between the root and the jawbone. And then from there, the infectious material can travel from that area. So one of the reasons, as you alluded to earlier, that persons with autoimmune diseases or cancers may experience an onset of disease due to an old root canal tooth is because the infection travels from the tooth and via the lymphatic system and or the circulatory system will travel
Yes.
virtually anywhere in the body, undisturbed, and will tend to exploit wherever the genetic predisposition for diseases or site of an old injury or some area where there's diminished blood flow, so the body can't bring its defenses to bear, and then it would tend to exploit that with infection. This is called the focal infection theory, meaning the focus of the infection may be here in the mouth, but it may be showing up in a heart or in a hip issue or a breast cancer or something like that. And
Yes.
the root canals now are gaining a lot of notoriety for their role in playing that. And for far too long, persons have been told there's no chance, there's no way, it's not possible for that to be a factor, when the data now coming, especially out of Europe, is suggesting otherwise, that this is exactly the reason why people have these unknown cancers that come out of nowhere and otherwise have no other explanation for why they develop cancer. Looking at that is important. Thankfully, persons like yourself and other allied healthcare practitioners are now getting hip to the idea that they must consider this when making their diagnosis, asking the patient about their dental history to uncover whether this may be a reason why that person's sitting in your consultation room or not, or why you're having this patient with a laundry list of medications, and which nobody has an answer for, may very well have its roots, no pun, in the dental history. Yeah.
Yeah. I mean, it's really scary because basically if we break it down, what's happening is there's an infection in the body, right?
Which,
And we know like the body's really smart. It wants to go after the infection. It
yes,
wants to heal from the infection. But here it is. It's kind of like, I'm going to call it an hidden infection.
it
And
is.
now all of a sudden your immune system is in hyper overdrive. And I always say the body doesn't do anything by accident. Everything is on purpose.
Correct.
If it's trying to figure out how to deal with that infection, it's logical that it can show up then as autoimmune disease. And I mean, I see this in my practice time after time after time. And yet, the root canals are being, they're out there as kind of like the only option or
Yeah.
best option. And this is what you have to do, but nobody's talking about the dark side, which
Right.
is exactly what we're going through. I mean, can you just from your background and experience, can you kind of go through a list of maybe some of the illnesses and ailments that have been associated with bad root canals?
Well, of course. I mean, the list is pretty extensive, and we can almost say that virtually any disease may be related to a chronic infection, where the inflammation resulting from the infection, as you alluded to, is stressing the body 24/7, 365, to the point where the body's going to, throw up the white flag and say, I can't do this anymore, in which case it'll break down. And
Yes.
again, maybe if there's genetic predisposition for disease, family histories, things like that, that may make it that much easier for the disease to express itself if you've had root canal treated teeth. So that could be eczema, seborrhea, psoriasis. Let's go through heart palpitations, cancers, autoimmune diseases. Any system, tissue, or organ could be affected by chronic infection. So depending on how many sources of infection there may be, and persons who have multiple root canals are at even greater risk, as one might imagine, that they're potentially to have more sites of infection bombarding the body that makes it that much easier for any disease to erupt. Perhaps even making it that much harder for someone to maintain their own microbiome, so that the gut is now all messed up because of a constant bombardment, depending on
Yes.
the diet. So you have all these things that come together to create the perfect storm, but usually the underlying cause is something that's been chronic, not necessarily a lifestyle challenge or choice, not necessarily a dietary thing, but this hidden infection, as you alluded to, is usually the thing that's going to be the trigger. So again, anything that can be responding to infection, whether that's a skin disorder or a cancer or anything in between, can be, we can point the finger at the root canals as being a predisposing factor.
Yes.
That thing that the body can't handle and can't overcome, which is why people are usually shocked when they get a cancer diagnosis or an autoimmune disease diagnosis. It seems to come out of nowhere, like, how's that possible?
Yeah.
So these infections are silent. Again, they don't cause people to be aware of them. And usually, in many cases, we find these purely by accident when a new patient comes in and we image them in our office and ask them probing questions about what's going on in this area. This root canal tooth ever give you trouble? And typically the person's with many things listed on their medical intake form usually have that root canal, or one or two of them, or a history of them having been extracted in the past. So there is really, I don't see any disease that can't be affected or caused by chronic exposure to toxins from root canal treated teeth and or old extraction sites.
Yeah, I agree with you. Just in my clinical background as well, we see it come down just so many times. And you're right. I want to point out, just to clarify for everybody listening, the scary part of the bad root canal is oftentimes you don't know it's there. It's not like a toothache. There's
Right.
no pain.
Which is
There's
why,
no pain. You're not noticing anything. It's just there, and you have no idea.
which is why people can walk around for years and years and years, decades even, with this thing going on and never connect the dots between their high blood pressure or their arthritis or their whatever they go to their physician for. No one's getting well, you have a root canal, then the immediate onset of a symptom. It
Right.
tends to build. It works behind the scenes for years at a time, and again, have other factors like a poor diet and maybe some poor genetics thrown in, and eventually the disease will surface. But again, no one's connecting the dots because they're silent. They don't hurt. And although a dentist might see something that looks suspicious on an x-ray of a tooth that previously had root canal therapy, let's say a darkness around the root tip, they may ask the patient, hey, does that tooth bother you? Or it might look like a whiteness around the tooth, which shouldn't be there. If the patient says no, they'll be like, okay, it's not a problem. When in
Right.
fact, that may very well be that there is a problem, but most dentists are not sensitized to the idea that anything that doesn't look like a textbook photo on a routine X-ray that a patient shows up with should be considered an infection, whether it's a light area or a dark area. It's the body's reaction to this chronic inflammation from the infection. But again, it doesn't just stay there. So we can see where the origin is, but it really doesn't explain to the average dentist or patient that this is the reason for your disease or for something that happened to you 10 years ago. So
Right.
it's
Right.
tough. It's tough for people to know that just inherently. They have to be told, or they have to come across the information on their own,
Yes.
serendipitously, or someone tells them, hey, I had a root canal tooth taken out and I feel great. Or they see a summit or a podcast like this and go, wait, maybe that's something I need to look into.
Maybe that's one of my issues.
Now it's time to go look for your functional practitioner and find out if it is.
Yeah, absolutely. And I'll tell you, like, I 90% of our clients have had root canals. That might even be a conservative number.
Hey,
So
depending on who you talk to, some people say 100% of cancer patients have root canals.
Mhm.
That's a pretty bold statement, yeah? But
Yes.
again, chronic infections may
Yeah.
not be root canals, but we have to talk about at some point the cousin to root canal toxicity, which is called cavitation, which is another silent killer. But the process and the source of infection are very similar.
Yeah. So why don't you explain a little bit of that, what a
Okay.
cavitation is, so they can hear. I know we talked about it in our last podcast, but let's dive in so they have it.
So okay, if we'll accept that in response to having root canal therapy, that the tooth eventually becomes reinfected again, or that we can say that maybe the infection was never cleared up 100%. Someone who might have required 2 to 3 rounds of antibiotics during the root canal procedure, still having trouble, but yet they kept the tooth in there and soldiered on, or did the root canal over twice. Those are the exceptions. Those people have some inkling that, something's going on there. But the idea is there's still infection coming from that area, mostly silent. What affects even more people is the fact that most dentists, blanketly recommend extraction of wisdom teeth around age 18 for an average patient. And probably in many cases for good reason. Lack of jaws, probably due to the epidemic of tongue ties and children who aren't being breastfed and the whole 9 yards. It's not helping to develop the jaws and the airways adequately anymore. The lower jaws tend to be smaller than usual, and generally lower jaw third molars tend to be problematic in that they get crowded out and create problems, which ultimately require extraction. The problem there is not so much that the tooth's being extracted, although removing any organ from the body is really not a great idea, but generally those people have an issue, and typically what will happen is that the area where the root was removed from, where the tooth was extracted from, that the bone socket does not heal properly.
Yes.
And incomplete, let's call it an incomplete healing of the bone socket due to many factors, which could be surgical technique, probably low vitamin D3 levels on most of those patients at 18-year-old kids that are going in there. Probably a really poor diet, which does not feature significant minerals or raw materials to help repair or rebuild bone. But
Yes.
suffice to say that a lot of times the quickness, the rapidity with which those teeth are extracted, surgeons are so practiced at this, they get them in, get them out, do a cursory cleaning out of the socket, and here, bind on some gauze or stitch them up and send the patient on their way. The reality is that the majority of those cases, the bone does not heal. The patient had dry socket or not. Most people may not be aware that their bone socket's not healing. And if there's any debris left behind, part of the root tip that broke off, or part of the periodontal ligament, or that the bone in that area was not debrided or surgically cleaned properly to encourage blood flow from the bone, not the gum, then that socket won't heal. And therefore that will harbor all sorts of baddies, things like microorganisms, heavy metals, other toxins in the body that can leach from that area, just like the root canal infection, via the lymphatic system and or the circulatory system from that site and wreak havoc somewhere else in the body.
Yes.
So cavitation, the incomplete healing of bone, which we now know is a legit term we can use and say with confidence that these do actually exist,
Yes.
generally have the same potential for causing harm, creating the background or the systems that might allow cancer to arise, autoimmune diseases, things like arthritis, low back pain, and so forth that most people don't connect. So the toxicity issue is very real with old extraction sites. The
Yes.
cavitations, which we'll call that, which is basically an area of very low density of the bone, which is how we diagnose them now, which is just generally confirming for us that that bone did not heal, in which case then you're not getting good health through that area. We're not getting good blood flow to that area. You're not getting the chi returning, the life force or life energy running through that meridian anymore. And that creates the imbalance that, again, has effects distally or outside the mouth.
Okay. All right. So now we've got these two things that are lurking. Well, let me take one step back, Dr. Fazio, because I think this is an important point, because yes, we can get ourselves to that space where we have to have a tooth pulled or we have to have a root canal or supposedly have to have, right? But
Yes.
how do we what are the signs before that? How do we even prevent ourselves from getting to that point?
Well, of course, the one thing we can't control is what genetics had in store for us. And it's unfortunate that some people are predisposed to dental disease, and that may very well be exacerbated by a poor diet or ancestral diet that was not really well-rounded and nutritious. But of course, having access to dental care to make sure that if something is developing an imbalance or what we call a systemic imbalance, the first sign of which is usually the formation of cavities. Okay. And in our office, we regard cavity formation not as an oral hygiene issue, but rather as a systemic issue, an expression of a biochemical / nutritional imbalance. Then, of course, getting all that stuff in a row will make it less likely that a person is going to have invasive cavities that will reach the center of the tooth where the nerve is. Again, barring physical trauma, a lot of front teeth are hit from children and adults playing sports and car accidents and such. Really, not much you could do about that. But the ones that we can prevent would be getting a good dental examination when the child's young, having a functional or biological dentist that's going to acknowledge that the formation of cavities is not just an oral hygiene issue, and then have the conversation with mom or dad that we need to make a nutritional intervention here, a lifestyle change, check the airway, check all the other things that that will help that patient be vital, and then of course prevent patients from having to make those hard decisions like, am I going to get a root canal? I'm going to have my tooth extracted.
Right.
So again, barring trauma, there's a lot that can be done nutritionally, fundamentally, having cleanings and checkups. But once the patient's gotten to that point, or I should say, when someone on an average day has a bad toothache, and it could be really painful, they'll go to a dentist, and if the pain is really severe, most dentists are right away thinking root canal therapy. To get a nerve to calm down is not so easily accomplished. However, one of the things that we do in our office a lot is that if someone has been told that they need root canal therapy, and I hate to use that word, but you need a root canal. Nobody needs root canal therapy, certainly not your tooth. But if someone is given the option of saying, listen, either you're doing root canal therapy or you're taking the tooth out, again, hard to say no when you're right there in the chair going, oh, just save my tooth. If the tooth is broken, badly broken down, or otherwise it was loose or something, okay, no one's going to say, yes, save the tooth. They'll say, just take it out. Most people have their mind made up before they come in.
Right. They don't know that there's any other options.
That's just it. And most dentists are not presenting that. They're going to say, listen, we're going to save this tooth. We're going to save this tooth. And I'm not saying that there isn't any ulterior motive on the part of the dentist. All right. I think majority of dentists are really well-intentioned. We all took an oath to do no harm and all that stuff, but feeling that the best course of action for the patient really is root canal therapy, because we are going to save the tooth. But then once you do the root canal, the dentist can also get insurance coverage for the post-core and the crown, the holy triumvirate of dentistry, which all dentists love to do. All right. So many dentists run or jump very quickly to the root canal option, and the patient really isn't given an option of saying, or being told, hey, listen, let's put a sedative filling in there. Let's bang up your antioxidants. Let's raise everything up. Let's maybe get some red light therapy going. Let's get some, whatever we can do, some hyperbaric oxygen therapy. Let's boost your body's ability to combat the inflammation, trick the body to calm down, assuming that there is no infection at this point, Danielle. Okay, but in cases where there's a major inflammation, we go on the assumption that maybe we can reverse that and get the tooth to calm down if we can figure out what it is that's imbalanced. Now, of course, if that tooth's on a certain meridian, that person has medical issues with a liver or kidney or something, it's on the same meridian, we take that into account and decide, well, maybe that organ or system is inflaming that tooth on that day. So that has to be taken into account. But most dentists aren't doing that. They're just having tunnel vision to say, your problem is here. The solution is right there. So either we're taking the nerve out or you're not, or you're taking the tooth out. What do you want to do? All right, take the nerve out. So again, not much an average patient can do, but in a biological or functional office, we're going to say, if there is no sign of infection, and obviously with a good x-ray, we can tell that, let's either do some intervention or not, put something sedative in there. Let's get a laser. We'll do some photobiomodulation on the tooth. Let's use some ozone, something to do that would just help relieve that inflammation, see if we'll give the tooth a chance at least to calm it down, reverse that pulpitis or tooth inflammation, and see if the tooth can calm down. And then maybe reappoint the patient, put in a non-toxic filling, using some ozone again to re-sterilize, use the red light laser, and help calm the nerve down in there. In the case of actual exposures, although I can't physically do it, I know there is New Hope now. A friend of mine out in Utah has now come up with a protocol that would use a different kind of laser, taking somebody's blood concentrates, mixing it and putting that over the exposed nerve, using, again, laser for photobiomodulation to help calm the area down. So there are ways to reverse that, but most dentists don't have that option. That tool is not in their toolbox. So again, the patient is not given that option. Again, the patient's not even given the fact that root canal therapy is not perfect, and that eventually the tooth will likely come out anyway. But in the heat of the moment, let's say, most patients are going to opt for that root canal, but not really realize what they're getting into.
Right. I want to take a step back to something you said, in case our listeners don't understand it or didn't quite catch it. And that is, you had mentioned that, hey, maybe someone is having some tooth pain because that tooth is connected to the liver gallbladder. And
Yeah.
some people as might be saying, what do you mean my tooth is connected to my liver gallbladder? So let's talk about your teeth and the meridian connection.
So I will tell you, every tooth corresponds to a certain acupuncture meridian, and these tooth meridian charts are easily available. Anybody can Google search tooth meridian chart or something along those lines. But again, in a biological functional office, we're considering that. We're always wondering when having a consultation with a new patient to decide. Let me say this: if someone comes in already knowing that root canals are an issue, they may want to know, how do I know if mine are hurting me? Can you prove to me, doc, that this tooth is really causing me an issue? From a blood test / other testing, conventional means, usually you're not going to get that information. Again, electroacupuncture evaluation, there are other, even kinesiology and so forth. Some people can tell you, hey, that tooth's causing a weakness in the body. Mm-hmm. But most people want to see something in black and white, have some concrete evidence that the tooth's becoming an issue.
Right.
And although I can't always provide that, I can say that there's a chance. And if we see something obvious on the x-ray, we can say that thing is probably affecting you some way. But if someone has a tooth that is hurting them, as we're alluding to, and we see no evidence of infection, how do we don't just jump right in to say, let's do a root canal? I'll ask them, hey, let me look that up, because each one of my operatories has one of those meridian charts on the wall. And I'll show the patient, all right, tooth number 14, upper left, root canal, upper left molar, let's say. That's on the breast meridian, number 14, also thyroid meridian. So if the patient has issues there, I might say, hey, this may be a risk factor. I'll usually stop short of saying it's the be all and end all, or that there is a cause and effect, but I'll look at it as a risk factor and tell the patient, hey, we may not get a definitive answer here. Sometimes with other imaging, we can prove that the tooth is actually showing infection. But to tell a person who has a root canal tooth on number 14 that they're going to get a breast cancer because that's on the breast meridian, or they're going to, excuse me, they develop a thyroid disease, nobody can prove that, even though the odds are that could be a role player there. So it's a matter of educating the patient, saying, look, this is probably a risk factor. What do you want to do? We don't tell people what to do. We say, listen, as part of the information you're learning today, take that into account when deciding, do you want to keep that tooth in there? Do you want to leave it alone for the time being? Do you want to, revisit that issue down the road or not? But that's one other bit of data that we can, give a patient or take into account when deciding, is this tooth an issue or not? Mm-hmm. Is the thyroid dysfunction as a result of the root canal, or vice versa? Did the thyroid dysfunction cause the tooth to start aching for no reason? That just scratches his head going, I don't see a problem here, but yet the tooth's, we might ask him, are you off your meds on your thyroid? Or someone's having a kidney issue of the front teeth, which is genitourinary meridians, there might be, something there. So we consider that a two-way street. The tooth can cause symptoms to the organ, or the organ can cause symptoms to the tooth. So if we're, considering that, we have to think big picture here. Let's see if we can, kind of put all the pieces together. Again, most dentists don't have the time or the inclination to do that because we're not taught that in school.
Yeah. Well, and I think that's part of the issue, right? So you've got this unique perspective because you've gone and you've sought it out, and what used to be considered woo-woo is now becoming like, oh, well, wait a second, there's a lot of merit to this.
Yes, there is.
People who are saying no mercury back then, and they're saying, yeah, mercury. Oh wait, hold on, we're gonna reverse ourselves on that. So I do think it is a matter of awareness of what's happening in dental treatment. It's no different than conventional medicine and holistic medicine, right? Hey, this is Dr. D. I just wanted to remind you that you can get started on your true wellness journey. Go ahead and check the show notes and grab a link to the True Wellness Checklist. Now, let's get back to the episode. There's things that I know as a holistic practitioner, basic nutrition for one, right? That's not taught in medical schools. No. So
barely on in dental school as well.
Yeah, it's a matter of that. So let's take a step. Let's take a step in the direction of, well, what do we do if we're told that we quote unquote need a root canal? I mean, what are the alternatives? And we won't even talk about the toxicity of the materials that are used for root canals.
Well, okay. I mean, unfortunately, when the diagnosis has been made that a tooth, I hate to use the term, needs root canal therapy, or that the dentist is going to suggest performing root canal therapy in order to alleviate the pain and the swelling to allow the patient to hold on to the tooth. There really aren't much options. Again, if someone comes to me before the procedure is actually done, we may be able to eliminate that symptom in a different way, whether that's cleaning out the cavity and using ozone to sterilize a tooth. For example, when we're in school, we're taught that if there's a deep cavity, whether it's close to the nerve or not, we must physically clean out or excavate all of the cavity or decay from the tooth, none behind. Makes sense. You don't want to leave that stuff behind, then you put your filling in. But if that cavity has penetrated toward the center of the tooth and the process of excavating or removing that decay exposes the nerve or winds up making the dentist drill contact the nerve, then the dentist says, oh, I'm sorry, Mrs. Jones, the nerve's been exposed. We don't have any options here. We have to do root canal therapy. Now the patient's numb. They're already in there. And now they're, told you need root canal or we're taking the tooth out. Again, most persons are going to say, all right, finish it. Do the root canal. Right? You're under duress. You're really not being given enough time to think, can I think about that for a day or two? Can I talk to my spouse about that? Can I talk to a functional doctor about that? No, it's not happening. So most people in the moment will say, yes, save it. So there isn't much of an option. Again, a biological dentist is going to say, whoa, pump the brakes. We're getting really close to the nerve. Let's stop excavating. Let's stop drilling. Let's either get your laser out, do some photobiomodulation, get the ozone out, fumigate. I'll use that term. We use the term insufflate, but fumigate the inside of the tooth with the ozone gas. Put in a calcium silicate or comparable liner, which is what we call dentinogenerative, meaning it will stimulate the repair of dentin. Keep that area sterile, and then put your non-toxic filling over the top. And again, at that point, now address other sources of inflammation that might have been contributing, the patient's poor diet, maybe not getting enough sleep, maybe they're dehydrated, all these other factors that might have allowed that inflammation to really ramp up that quickly. Address those, and then 9 times out of 10, we're saving that patient from root canal therapy. Biological dentists don't want to do root canals. Those of us who really believe. We're looking for an alternative to doing that. Conventional dentists don't. They don't have any tools in their toolbox. They don't even know about ozone, let alone taking a laser out. They're not going to do it. They're going to just say, well, we're there. We got to do the root canal. Sorry, this happens. Nothing personal. It just happens, and you got to do this.
Yes.
And again, most patients they don't really have the time. And if they don't have the education on their own, then they don't even know that there's an alternative. They don't even know, hey, can you just stop it? Put in a temporary filling. I'm going to go somewhere else. I want to go to Fazio. And that's typically when I see these patients. They've already been told they had root canal, and they want to know, can my tooth be saved?
Right.
And many times we can, but if you have the right tools. And unless the dentist has gotten some special training, they're not going to be able to offer that as an option.
Right. So, I mean, what are the alternatives then?
Well, I was going to say, it's either you're having someone who can actually save the tooth, excavate that cavity, sterilize it with the ozone, the laser, get it to recover, combat the inflammation, and get everything to calm down. Great. That's a high five moment. Everybody's happy.
Yes.
But if the tooth can't be saved, or even if the patient comes to me already after the fact, really the only alternative to have is removal of the tooth. Okay. So this is why it's very black and white. You're either performing root canal therapy or you're taking the tooth out.
Yes.
That's the message most everybody's going to get. Once that decision has been made, or once a patient's at that threshold, then either they're going to keep that tooth or they're going to say, all right, I'll take it out. Again, the average person at the time root canal's being done, all they know is that their symptom is being alleviated, and they're very grateful for the alleviation of pain and symptoms, and swelling goes down, all that stuff, and everybody's happy. Sometimes a patient will start doing a deep dive afterward. If it's their first one, they might easily come across some information that might suggest that root canals are risky, in which case they may decide, I'm going to get this thing out of here, depending on what information they come across. But most people won't. And so they'll, let's say, hold off on it. Again, if everything's feeling okay, they'll think, well, no pain means everything's good.
Right.
And that's the trap. Okay. But for those who got to the point where they don't want it, or they're saying, nope, I already knew before coming in, I'm not doing root canal here. Then we say, okay, extract the tooth. The key with extracting the tooth depends whether the infection is new or it's chronic or old.
Okay.
The surgical technique can vary slightly. So if a tooth's being removed, it has to be done just so in order to ensure that all remnants of the infection, which we previously said that leaches out of the tooth into the surrounding jawbone, okay? So if everybody will remember that the roots of the teeth are essentially inside your jawbone, but not in direct contact with them. There
Yes.
is around each root is a shock absorbing ligament. We call it the periodontal ligament, which is a microscopic space between the root and the tooth. This very important structure allows the body to determine, do I need to chew harder, or is there something too hard in my food? It gives the teeth some give, kind of like shock absorbers around the roots. Um, and if that ligament, which is between the root and the bone, becomes infected after a root canal, that ligament has to be removed because it's now diseased. And
Yeah.
sometimes during the surgical removal of the tooth, that debris may be left behind, or that ligament may be left behind, which can impede or prevent proper healing of the jawbone. Sometimes, if the infection was brand new, or someone's having something that just recently occurred and the infection is not what we would classify as chronic,
Mhm.
a lot of times the infection becomes very superficial outside of the root, in which case cleaning the bone and removing the infection is a little easier. All right.
Okay.
In which case the infection had not been embedded into the surrounding jawbone like chronic infections tend to do in response to long-standing, again, years-long, decades-long infections. But still, the socket must be debrided or surgically cleaned properly to make sure that all debris is removed, that blood is reestablished, or blood flow, microscopic or capillary blood flow, is reestablished into the socket from what we in the business call four walls, meaning from every angle that the blood is flowing back in there, and that then allows the bone area to fully heal. A bone graft, typically, if someone's going to have an implant later on, that's usually worked out in many cases ahead of time. And sometimes a bone graft will be put in to help speed up the repair of the socket in anticipation of maybe an implant or not, but just to make sure that all remnants of the infection are gone and that we affect the full and complete healing of that bone socket from top to bottom as if
Mhm.
it was never there. And in that case, then we're restoring health to the socket, we're reestablishing the meridian, and the chi will begin to flow, and that tissue, system, or organ that's on the meridian will then return to health as well, or will prevent those areas from falling into ill health if the extraction is done correctly. All too often, the extraction is not done correctly, inadequately, and all too often, debris is left behind, and the patient heals pretty well, but maybe not as great as it could.
Mm.
And as I alluded to earlier, if that person's vitamin D3 levels are inadequate, if their diet and nutrition is poor, they're going to have a tougher time healing anyway.
Yes.
So when people are having this and making a decision, I already had the root canal, but now I want to get it out, then we're going to say, all right, well, we can do that. There is a protocol for safely, properly, effectively removing the root canal without collateral damage and ensuring that all the infection is out. But let's prep your body first. Before
Yes.
you have this, we're going to have you go through some vitamin D3 testing. We're going to get with your physician, and we're going to find out, are there any other meds you're on that might be affecting you? Let's get your diet done. Let's consider IV therapies in anticipation of, or even on the day of surgery, to make sure that your body has all the ammunition it needs to fight the infection and to fully recover. Again, good surgical technique is incredibly important, but we can kind of prep the body, prep the terrain, as my friend Judson likes to say. Get the body ready for that surgical intervention, and do whatever we can to ensure that there's going to be good blood flow. Let's use nitric oxide. Let's use red light therapy. Let's use lasers. Let's use all those hyperbaric oxygen therapies to help the body help itself. In those cases, then we can eliminate the disease, encourage the healing, and return that patient to health.
Yeah, love it. So I'm going to summarize and interject if I've missed some spaces. So number one, right? First and foremost, we always want to go with prevention, right? You want to make sure you're getting your minerals, your vitamin D. You want to address airway issues, which we've spoke about, and we've also had Dr. Lane Martin speak about airway issues. So we want to do that. And then if there is some indication of a cavity, we want to take care of the cavity rather than letting the cavity go for a really long time. So it doesn't end up into a root canal potential scenario.
Right.
And then if there is the need, and again, we're loosely using the term, if it needs to be suggested, then you want to prepare your body if your body has not been prepared.
Correct.
Right? Did I miss anything along?
No, I mean, I think it can be that simple, Danielle. And again, most people aren't thinking along those lines. They're not being taught by their physician to think along those lines. Again, if they're lucky enough to see your podcasts and be a client of yours or a patient of yours, they'll get that information. But the vast majority of people don't. Unfortunately, a lot of them get it. Not that it's too late, but after the fact, and when they start looking for alternative cures for their chronic diseases, and then they start to stumble across the dental connection, that's when most people's minds get blown. Going, wow, no one. They could have told me this 20 years ago. It might have saved me a lot of
Right.
suffering. But again, we don't had back 20 years ago. We didn't have enough physicians or allied healthcare practitioners that even acknowledged or knew that there was a dental connection. So
Yeah.
the information is more freely available. It is easier for people to start educating themselves to know I need to be prepared. I need to be my own best advocate.
Yes.
Before I go to the dental office, I bet to arm. And if your dentist, if you do that and you go to the dentist and he starts or she starts fighting you and becoming distant and or defensive, that's when you know you need to go somewhere else and get someone who's going to be open-minded. Because most dentists, they don't want to hear this. They think they know everything, and what we're taught in school is the gospel, and anyone that says otherwise is the heretic.
Right.
And I will tell you that it's up to the patient to decide for themselves what makes sense. Do you want to keep a dead tissue? Again, with the root canals, the only instance in all of medicine that we allow and or force the body to hold on to a dead/infected tissue, thinking that
Yeah.
that's okay. That organ is killed. That tooth is dead. We think that's okay. So the body's going to eventually react to that foreign body. But if that foreign body is also infected, there's your deadly 1-2 punch, and that's going to become an issue at some point.
Yeah. So scary. And it is, we don't let any other dead organs remain.
Or else,
Why are we doing that?
somehow it's okay.
Yeah. Why are we doing that? So, I mean, everybody who's in the New York, New Jersey, Connecticut, that area where you can get to Dr. Fazio, make sure that you get there. If they're not located in your area,
Yep.
how would people search out a dentist who understands this, oral health, whole body wellness, who isn't just going to be like, okay, let's stuff your root canal with gutta percha.
Well, I mean, I think the easiest thing to do nowadays, as opposed, everybody's going to type in do a Google search,
Hmm.
biological dentist near me.
Hmm.
They should be able to tell, and of course, usually you get some websites that'll pop up, and any dentist/surgeon who's really worth their salt is really committed to being a biological or functional dentist, holistic dentist, whatever you want to call it. You should be able to glean that from their homepage on
Yeah.
their website. If that person is truly committed to that, there's going to be some mention of biological dentistry, holistic dentistry, something referencing root canal toxicity or mercury or something along those lines.
Hmm.
Usually, those persons, whether they're doing the surgeries or not, would likely have some sort of, let's say, network of support, allied practitioners, an oral surgeon, somebody who's open-minded, who can perform the treatments required. We're very fortunate in the tri-state area that we're such a concentrated area that there's within 30 to 50 miles is somebody that you could be seen
Yes.
by that would be able to provide you with the services and answer your questions to your satisfaction.
Yes.
But there are a number of biological holistic dental organizations that people can search for members in their area.
Hmm.
One we can probably add some to the to your
Show.
podcast, Danielle, that people can read up on at the end. But the International Academy of Oral Medicine and Toxicology,
Yes.
the Holistic Dental Association, the International Association of Biological Dentistry and Medicine are three of the biggest in this country, anyway, organizations that train and are forwarding, I should say, moving the consciousness forward to let people know that there are alternatives there and that people should be doing their own research and be educating themselves to know exactly what they're in for when they go to the dentist and to know what their options can be and what they feel might be in their own best interests and
Yes.
not in the interest of the dentist that's doing it. So again, it's out there, much more freely available nowadays than it was even 10 years ago. And
Absolutely.
I really feel like since the corona situation that occurred, more people are doing exactly that.
Yes.
I'm seeing many more patients calling up, even younger persons in their 20s now, wondering, do I want to keep this stuff in my mouth? I never saw that. I always used to see older persons who've been around the horn, are victims of chronic disease, and now they start looking for alternatives in their 50s and 60s and 70s.
Right.
We're seeing younger persons who are probably a little bit more hip with the stuff coming across their phones, and they're more open. There's so much more information coming across to them that they're, you know, hitting on that, and now they're acting on it.
Yeah.
So it's easy to find. You just got to know, what should I look for? A
Yeah.
biological dentist near me. Of course, people can send me emails, and I can always point them in the right direction, depending on what part of the country or the world that they're in.
Yes.
In which case, I'll gladly do that. That's something I pay forward. And but again, if they want to just type in holistic dentist near me, that doesn't always give you who you need, because there are a lot of people now calling themselves holistic just
Right.
because they might not offer amalgam filling, but they
Yeah.
might not know anything about the root canal controversy, or know the limitations of oral surgery or cavitations, or what they might be. You need to find someone who's advertising as holistic and biological. Those
Yes.
of us who are using that terminology are now distinguishing ourselves from the pack, to say that, listen, we're at a different level of understanding,
Right.
that this is not such a flippant thing, that, your teeth are maybe one of the most important things in your body. And
Hmm.
everybody realizes that maybe 90% or so of the invasive procedures done in the course of someone's lifetime are done right in their mouth. And there's a good chance that that's going to have some repercussions later on. And again, educating themselves, knowing what I want, what I don't want before going in. But most dentists who are biological will immediately make those people feel comfortable in there, when they don't shake their head and they say, "I hear you." And those
Right.
that's what people just want to be heard, and not felt to, or made to be felt ridiculous for voicing concerns about fluoride or root canals or mercury when they go in there. But the tide is changing. There's a lot more younger practitioners realizing that this is the future, and that future is now.
It is. It
Yeah.
is. I love that. Well, Dr. Fazio, if you could give one message to our listeners about oral health and, whole body wellness, what would it be?
Wow.
All
Um,
right. We have two if you need
yeah,
to.
no, again, there's a lot I could say. Of course, again, educating themselves, and just understanding that everything that's done in the mouth will have a repercussion. And if you can, again, it's hard if you have a really great relationship with your current dentist to just disregard that person, or even if you ask him, the dentist may shoot you down about anything I just discussed today.
Right.
It's important that you hear from other sources. Again, I'm not asking people to take my word for it, I should say. I'm just a messenger here. But again, the information is freely available. You could just type in keywords on a Google search when you have time.
Yes.
Root canal toxicity. Simple as that. Root canal toxicity.
Hmm.
Root canals and cancer, root canals and disease, something along those lines. Type
Yes.
in the word cavitation, and just read the incredible amount of information that's going to come down. In
Yes.
that case, again, an alternative viewpoint will be had. And I think when people see the logic behind why persons like myself are not happy with the conventional treatments, that they're going to become more motivated to get even more educated, and then say, "Hey, doc, I love you, but I need to go somewhere else, because I need to get what I need to get from someone else that you're not providing." It's not so easy, but again, I would say, be your own best advocate. And if you can find a dentist who becomes your next best advocate, your partner in health, then you're golden. That will, I promise, will pay dividends in long-term health.
Absolutely. Thank
Yeah,
you. All
sure
right.
thing.
And tell us, Dr. Fazio, how can people, we'll have it in the show notes, but for those
Yeah.
who are just listening, how can they find your practice?
You can type in my name. I'm the only one with that particular name, Dr. Fazio's Holistic Dental Wellness, located in Smithtown, New York. Um, Again, I've been putting out a lot of content for a lot of years, Danielle. Thanks to you as well, that I'm easily found in there. And however you type in my name, you'll get directed to my website. It always comes up on page one on Google, and in which case there's ability to send comments or emails, or contact to the office email account, which will then be forwarded to me. Like I said before, I'm gladly helping people get educated, point them in the right direction if they're not local enough to me to be treated or seen by me. We always welcome persons from out of town, but if someone's, like I said before, in another country or whatever, you can go to our website, holisticsmiles.com. You can go to just Google or YouTube and look at our videos and get educated again. But 631-474-7477 is the phone number. The ladies at the front desk are very, very knowledgeable, and can also help get people pointed in the right direction.
Awesome. Well, thank you so much for your time today. I know it's always fun speaking with you, and I know everyone should stay tuned because you've got some good stuff coming down the
Yeah,
pipe.
we got more stuff to talk about too. We can do that again. I look
Yeah,
forward
toothpaste that might be coming out at
to
some
working on it.
that'll address some of the issues that are happening in
Yes.
that realm of the
It will
world.
help the nutritional approach and help it get a little bit over the hump there. So
Yeah, love it, love it, love it. So we'll all stay connected. And Dr. Fazio, thank you so much for
thank
your
you. Alex.
courage. Yeah,
Thank you so much for having me on.
yeah. I want to thank you for your courage and your willingness to step outside the conventional box and to really look at what a human being really needs to be able to heal. So
I'm happy to do it. I really feel blessed that I'm not just a glorified tooth mechanic anymore. I like being involved in my patient's health, and it's a great feeling for an average dentist for a biological dentist, to be feeling like they matter. And I get a lot back from helping my patients out. It's really a pleasure.
yeah, thank you. All right, everyone. We'll see you next time.
Thank you.
This is Dr. D reminding you to tune into your body, connect with what matters, and embrace the journey to true wellness. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with someone who's ready to redefine their health. Be sure to grab a copy of the True Wellness Checklist right in the show notes. Let's keep redefining wellness and empowering change together. See you for the next episode.